So good morning all. Can anyone say what is this?
Ambu Bag.
Ambu bag. What does mean by ambu? Okay. Ambu means artificial. A for artificial. Okay. Next, M for manual. You are giving to the patient in a manual way. B for bag and breathing. Okay. You are giving a breathing through the help of bag. And U for unit. Okay. Artificial, manual, breathing unit. So before going for an Ambu bag, we are going to see about the parts of it. Okay. What is this? Is a reservoir where you can give an amount of oxygen to the patient. So this bag capacity is of 2000. So this is an adult bag. So the size will be differed for each and every patient. And this is a, what is this? This is a self-inflating balloon. You can say it is compressive. It is a self-inflating balloon. This is a pressure relief valve. Can anyone open this? You can open this and you can leave. So this is a pressure relief valve. So once you give a high pressure, automatically the relief valve will open and close. And you can see a valve inside. Inside it you can see one valve. It is opening and closing. This is also a valve. This is a pressure relief valve and it is a valve present inside. And this is a mask. This mask covers nose and the mouth together. So we are giving an inflation to the patient. So what are the indications for using this Ambu bag? Yeah, very good. During CPR procedure and during emergency procedure, we can give an artificial breathing with the help of Ambu bag. Some institution they will use this manual bag, or else you can directly connect this with that O2 line. You have an O2 line here. Okay, you can connect a port. With this port, you can connect an oxygen line to the cylinder so that the cylinder will deliver the amount of air. But we have to selfly inflate and deflate it. So how to place this to the patient? Can anyone do it? Yes, very good. You want to see both nose and the mouth together. So you are giving a compression along with the nose and mouth. You should not give a much compression to the patient. Why? Because the air will also enter from the mouth. It will go to the stomach. That will be controlled with the help of valve present inside. The valve will control the amount of air which is entering into the stomach, so that the air will continuously flow into the patient nose. Okay. The size of this mask will have different. So this mask is made up of a flexible plastic, and this bag is made up of a silicone. Okay, it is made up of a silicone. So you are giving an amount of air to the patient in this way. Okay. So while you are giving amount of air in this manner, you want to see the movement of chest. The chest has to rise up and come down. As it is a mannequin, if you are giving for a normal patient, that you want to monitor the level of chest. And amount of oxygen delivered through this Ambu bag for adult is almost from 1600 to 2600 ml of air we are delivering to the patient in this bag. So there are different sizes of bag according to the patient's age. So for pediatric patient, the size will be reduced. You can deliver up to 450 ml. For neonatal, you can deliver 100 ml to 200 ml of air to the baby. Okay. Can anyone do it? So you want to keep your hand in this position so that the mask will not go away. While giving, you can see the valve movement here. The presence of valve movement. The opening and closing of the valve will deliver the amount of air inside, and you will have a pressure relief valve. Once you give a much pressure or much compression to the self-inflating balloon, so that only it will rise. Any doubts in Ambu bag? No. Is it okay?
This is not.
Yeah. This is not filling up. Why? Because we are not giving much amount of air here. Which sometimes it will be freely filled. It is freely filled with oxygen. Sometimes we will be connecting an oxygen line here. You can see some other ports here. You can see another pigtail and a pressure relief valve here. So that the amount of air will be entering through this line. You will. What is the color of a gas line?
Green.
Green color. Green color is the color of a gas line. You will be connecting here.
And this bag will be present here, but the line will be connected.
Yeah, line will be connected here. and the line will be connected to the oxygen cylinder. So for sterilization purpose, you want to dismantle all this in separate way so that you can have this, like you have to separate this bag, and you can see the pigtail here. Likewise, you can separate this also because you will have an sputum or any form of things will be present in this mask. So everything should be cleaned while giving for a patient. So this is also what form of sterilization can be used for this Ambu bag? Yeah, it is a heat sensitive. So ETO sterilization is good for an Ambu bag sterilization. Any doubts in Ambu bag? Is clear?
Yes.